Hormone injections, the woman who says they slimmed her down, and why others say it's just not safe. You've probably seen the pills and the shakes that promise to help you lose weight. Well, how about giving yourself a daily hormone injection to help shed a few pounds?
People claim it works. The question is it safe? Monica Dean with more on the hormone injection diet.
The diet combines daily injections of a hormone produced in pregnant women, combined with a strict diet and exercise. The injections are not approved by the FDA, but that's not stopping some San Diegans from trying it.
I've lost 40 pounds in 10 weeks.
Renee Lucky is on the HCG Slim Express diet. Every day she injects herself with a small amount of HCG, which stands for human chorionic gonadotropin. The injectable hormone is extracted from the urine of pregnant women.
The reason why I believe this actually works is because I'm not hungry whatsoever.
Not hungry even though she's on a strict high-protein diet, eating less than 1,000 calories a day. That's part of the program. Naturopathic Dr. Ryan Shelton with Natural Health Technologies in La Jolla prescribes the injections.
Pinch a little bit of abdominal skin.
Shelton says the hormone has been used for weight loss since the 1950s. He says the shots help patients burn fat 3 times faster than diet and exercise alone.
Also, a very important part of it is that it reestablishes the communication between the brain and the fat cells.
He says on average, men typically lose a pound a day, women a half a pound as they work toward their goal weight.
People on our program not only are losing weight, but they're feeling pretty good doing it, meaning they're not struggling with hunger, they're not struggling with fatigue, which is really common.
It's a quick fix. You can't live like that.
But this woman, who did not want to be identified, says she used HCG injections 2 decades ago. She says she lost more than 40 pounds, but things changed once she stopped the diet.
I did drop weight very rapidly and kept it off for a year, but after that I gained it back very rapidly after about 1.5 years, and it was ever since then I've struggled, and that was 20 years ago.
Now she's a patient of Dr. Sunil Boyrol, a laparoscopic surgeon at Alvarado Hospital. He sees many patients who have failed using HCG, a weight loss therapy not federally approved.
And there's a reason that it's not FDA approved, because it's not safe and it's not effective.
Turns out, although HCG is typically characterized as a pregnancy hormone, Dr. Boyrol says it's also produced by cancer cells in patients with liver cancer.
You'll be hard-pressed to find a medical doctor who says, I'm going to let you inject a hormone produced by tumor cells into your body, which hasn't been studied, in which we don't know the long-term side effects, and in which no clinical study shows that it makes any difference to the diet that you're already on.
Ryan Shelton says just because the chemical is produced by a cancer cell doesn't make it dangerous.
In terms of the actual substance, it's a very safe substance, and we use it at a very, very small dose.
He says the FDA has approved much higher doses of HCG for treatment of fertility patients. Dr. Boyrol says although the long-term adverse effects are unknown, he says many HCG dieters experience a rebound effect.
When you come off the diet, you tend to regain your weight.
But Ryan Shelton says most people who stick to the maintenance program are able to keep the weight off.
I've never felt better. I'd highly recommend it.
Renee Lucky plans to lose another 20 pounds using HCG and says after the shots, her diet and exercise habits will be different.
So it's a life change for me. I won't go back.
The HCG Slim Express diet costs about $200 for the first few weeks. The more weight you want to lose, the longer you'll be on the diet. Shelton says the diet includes a transition program after patients stop the injections. He says some people benefit from further hormone therapy after that. Monica Dean, NBC 739.